Well, isn't this cool? What a fantastic day this is turning out to be. For us, going beyond behaviors in gay men's research was like a venture beyond our well-defined field boundaries, along trails less traveled and without many affirming signposts, and a huge landscape to get lost in. We've had to break mental habits, like our usual focus on individual outcomes and correlates of risk. And quite frankly, we're happy to let all those things go because there's other people doing them, but crossing that boundary is like going out of bounds on a board trail. The snow is fantastic, but one bad move and you might not get rescued. Oops. I really have to thank Trevor for a fantastic introduction to my paper, because he's done a really good job of explaining minority stress and syndemic production. But these are the theories that have been most with us while we've been writing, designing the Sex Now survey that's gone national in the last 2 rounds. Social determinants was what got us there. We started going in that direction largely based on Canadian policy. Population health, social determinants of health are Canadian policy. But when you start going there, one of the things you realize right away is that there's actually no plan of research. And so you're thrown up on the rocks immediately with social determinants. It all sounds very enticing. It sounds like it works for gay men. But you know what? You can't do this research with gay men, or not very well anyway, because we really just don't have the databases that have sexual orientation as a category from which we could actually do such research. David Brennan, who's here with us today, is one of the few researchers in Canada who's done anything with the Canada Community Health Survey, and even there, even though they ask social identity or sexual identity questions, they're really only minimal, and they don't ask who you have sex with, which is a really important variable. But the other really important theory that we've been using is intersectionality, and you've been hearing us talk about this. It's a real paradigm in its own, and has been really hard to get a handle on it, but through 2 years of work, we've actually gotten there to the point where we're now applying it quantitatively after the Spring Institute on Intersectionality that was held here last year. I too am really impressed with minority stress, and of course you know that we had Ilan Meyer here, and this is the actual model of one of his colleagues, Sharon Swartz, who has shown us how to actually apply this in doing analytical work on a survey database, for example. And you see that this model kind of shows how a structural disadvantage, the kind of stressors that Trevor mentioned, ends up in mental disorders, and it only helps to reinforce itself and make the matter worse. One of the things that we explored in this survey was gay men's work experience. And that may not seem at all attached to what we're doing, except that determinants of health very much depends on a study that was done in the workplace in the 1960s and has been replicated and is still going on. But our starting place was really the workplace lore of ordinary gay men that we work with, and the kinds of things that they talk about, things that have gone on. And we had our young investigators actually hold focus groups to find out more about this lore so we could develop the questions for our survey. An important point about the workplace is that it really is one of the very big sites in our lives of gender order, and where masculinity is playing a real role in the dynamics that go on in our work with each other in the workplace. The study I was referring to that is the origin of Canadian health policy is called the Whitehall Study. It was a study of the British bureaucracy. And the whole idea of gradient, which this talk is titled, comes from that study, where it was noticed that social status is health status, essentially, that the higher ranking that you are in social status, the better health you'll have. So we wondered what would happen if we use this model to help in our work. And here I wanted to introduce exactly what a gradient is. The Whitehall study showed that those people at the executive level who have high control over themselves and their work have less distress and less heart disease. And those in the middle management, as you can see, have double that, and those in line have even more. So that's what a gradient looks like. It's a little step diagram. And this really interested me because I could see that when we were working with our data on the workplace, it seemed like a familiar pattern. So I began then to plot the data that we had. So just a few things about the Sex Now survey for those people who don't know it. We ran this survey from September to February 2012. And we ran it online. It's all online. Did all of most of the advertising online. We had 8,600 participants. All provinces and territories were covered. Our average age 43 and range anywhere from 13 to 84. Now here's the big part. Gay 65%, bisexual 32, straight 2. This is the first time in doing these national surveys that we have seen such a big turnout of bisexual men. When we first started doing the Sex Now survey, bisexual men represented less than 1% of our survey. So it's gradually increased, and that's been an effect of going on the internet, I believe. But the other very interesting part of this is because we ask not only about sexual orientation and who you have sex with, we also ask about partnerships. And so we had in the survey 21% of these men who were married. This shows you the coverage of the country. It shows you in a number of dynamic ways. The charts sort of represent roughly the size of contribution of each province and territory, but it also represents the contribution of urban, rural, and suburban men. And one of the things that I noticed about this was that roughly the distribution of urban, suburban, and rural men is about the same in every province for the survey. And another important point is that we collected postal codes, and that we collected about 72% of all postal codes. So just remember the triangle Schwartz and Meyer model of doing the analysis. So this is going to be our within-group analysis of the workplace study. Some of you have seen some of this before, but I had to breeze through the workplace study to get to where we're going to go. So one of the really interesting pieces was privacy. And here we note that about half of people consider privacy at work to be very important, privacy about their sexuality. And you do see sort of a gradient in here when you're looking at the whole sample of ranging from very important to not too sure. And this turns out to be, privacy turns out to be, in fact, a kind of indicator of social status as we work through the analysis. Well, then who's out at work? Well, here we find that about half are and half aren't. So again, looking at the whole sample, we get an idea that there's about 40% that are out to no one, and some that are not out to very many, and you do get a sort of group there that's out to everybody. Well, what about employment discrimination? Well, here, this is kind of interesting, and when I first saw this, I thought, well, there can't be that much of a problem, but, you know, when you see this working up to be about 17%, the interesting thing about this in epidemiology is that almost all high-risk groups are in the 15 to 17% range. So we wonder what will this group tell us? But you really don't learn enough about this by looking at the whole group. You really have to break it up in some way. And this is where we were challenged with finding some sort of grouping in which we could show a between-group analysis that actually could show us something about different levels of social status and the health effects going on in the survey. We had to do some work on this because some kind of conceptual work on this because, for one thing, intersectionality has a critique of social categories to begin with, and the idea that being that their social categories in themselves don't really explain the kind of movements that people have in their lives. Just think when we just saw a diagram in which we saw that there were half of the people who were out at work and half aren't. There's got to be some gay guys who aren't gay when they're at work, but they're gay when they're at home. And with bisexual guys, they're even less disclosed. Now, the thing about MSM, or men partnered with a woman, is that they're really not exclusive of either gay or bisexual. But by virtue of being married to a woman, they formed a separate group in our mind, at least in the way that they present themselves. But when we looked at this group, we saw that there's 85% of this group is bisexual, 10% claim that they're gay, and 5% straight. So this then was the way we formed the groups to do this analysis. So we have groups that are based on the intersectional idea of social location rather than long-standing social science tradition of having mutually exclusive groups. We're actually going to set this up so that we can see the differences between gay, bisexual, and men married with, partnered with a woman. So this is what we see in terms of privacy, that very few gay men compared to bisexual and MSM consider privacy important at work, and we see the little step diagram again. So we're wondering what this might tell us about social status. We also might wonder what it tells us about sexuality. This reminded me of Foucault in the History of Sexuality's comment that even in Greek classical societies where there were few, if any, prohibitions on sexuality, that the higher status that you were, the more discretion that was observed amongst men about the sex they were having. And I think that that paradigm is still working here. So when it comes to out at work, remember there were half that were out at work in the whole sample and half that weren't. Well, this is very interesting because you see here, once again, that it's really gay guys that are out at work, and the other guys, by and large, are not. Followed by employment discrimination. Again here, when we saw that it was 17% in the whole sample, it's 22% for gay men, which means that we're getting to the range of 1 in 4 gay men have had some experience with employment discrimination. And we've used a very high standard of this. This is not just existing in a homophobic workplace or having to listen to faggot in the street or anything like that, or in the office. This is actually dismissed, rejected, or restricted from advancement in employment. And so we see that the kinds of, this was a question that we asked about, did you think that your sexuality damaged your career? And we see here that it was gay men, by and large, almost double over bisexual and MSM, who felt that kind of career damage. And I think from a social point of view, we see this as undergoing a status loss due to the discrimination at work. And we also noticed that the people who claimed this career damage, that 56% of them had had discrimination. So then I began to wonder about other things, like having seen this step gradient in workplace discrimination and privacy and being out in the workplace, what else could we see? And so here is what it turned out to be for annual income. We see that gay men, by and large, are not making the kind of incomes that bisexual and MSM are making. And when we look at higher education, we don't exactly see that step pattern, but what we learn from this is that gay men on average are better educated than MSM or bi men, but make less money. And we also learned that when you look at property, that bisexual and MSM are far more likely to own property than gay men, and this is looking at it in reverse. Let's look at unstable housing, and here we see that gay men, again, fare worse in terms of unstable housing. So the third part of the analytical model was to look at outcomes, and this is what we call the main effects model of a multi-layered model that we're doing in intersectionality now. And this is just looking at the outcomes. There's three other parts, there's three other blocks to the model that tell us who is most affected and what kinds of things are affecting them. But this is just to show us that there are real health outcomes that come from prejudice, as we've been able to find it in the Sex Now survey. And you'll see that status loss. By the way, I just want to say for people who don't understand these numbers that the big numbers mean a big effect, and the lower numbers mean less. And the numbers that are less than 0 mean that it's really not that significant, or we're not having an above average effect in the model. And so you see that what we have is a doubling of suicidality as a result of prejudice. We don't see depression significant, not right here anyway. We see there's a big, huge increase of emotional care seeking. And what do you know? Even though we weren't looking for correlates of risk, we find that that HIV sexual risk is increased in the model, and that STIs are as well, and we put gonorrhea in here just to show you exactly what gonorrhea represents in the model. So we do see some sexual risk coming out of prejudice. Intersectionality asks us to move on a little further, and rather than show you a gigantic table with all the numbers in here, I just want to show you the results of our intersectional modeling. And here we found out that in under 30 men, that depression is significant. If we look at class and look over at 100,000 a year, we find that, well, sexual risk isn't much of a factor in that model. If we looked at visible minorities, we find that, again, sexual risk we didn't see as significant. If we look at HIV positive men, we find everything else but suicidality is not there. And if we look at bisexual men, we find that neither suicidality nor sexual risk is influenced in the model. So this got me then looking at gradients all over our data, and I had the MTRAC database, we called it Man Count in Vancouver, and so I looked then at our blood samples, and what do you know? Here comes the gradient again, as we see gay men, even from the blood sample evidence, fare worst in the model. And this, the man count survey asked for, got enough straight men in the survey to actually be able to do some analysis with straight men. It did not ask about partnerships, and so we don't really have the same information about men married to women in the sample. And this shows the same thing with Sex Now. Again, being a very diverse sample across the whole country, not concentrated in bars in Vancouver, we have a different kind of result with HIV positive reporting than we do across the country, but it's the same thing. Gay men fare worse. And here it is with sexual risk in man count. We saw no sexual risk amongst straight men, so they're at the bottom of the step diagram there. And again, we show gay men faring worse. Here it is in Sex Now for the whole country. We, if you'll note here, there's about a 10-point difference between sexual risk picked up in man count and sexual risk picked up online across the country. So once again, privacy and disclosure. Very important in, it seems, the self-protection of bisexual, straight, and MSM around any kind of sex with other men. So this, in terms of physician disclosure, tells us again that gay men are the most likely to disclose, and we see bisexual and straight men least likely. And this is what it was for Sex Now. Quite dramatically different when you're looking at the spread across the whole country and not just Vancouver. So in the models that Trevor was talking about, exposure to violence is part of the Syndemic Production model, and here we see, once again, gay men fare worst. Suicidality, again, the same thing. And this was the one that really saddened me quite a bit, was even if we called healthy, happy, and optimistic the resiliency factor in gay men, we see that when we pose it in this model of analysis, we see that gay men's resiliency isn't even as good as bisexual and MSM. And the one thing I want to say about this is what drags it down is gay men's dysphoria with their own bodies. And that's really the big single feature in the way of looking at this. This combines three questions to look at this, and it's really it's the body dysphoria that brings gay men down. So this is Barry's work on the Global Fund that I've plotted the same way, and this is what it is: gay men fare worse. So you really have to ask yourself what's going on here, and how does social inequality play such a role in the epidemic? I don't have all of the answers for that, but it really is telling when you see it this way. I should say as well that there were some things that did not come out in a gradient. They came out as a flat line, and the interesting thing about it is that they were all the variables we thought that were needed to explain gay men's problems in the workplace. We thought it was all about gender conformity issues. So we asked a lot of questions about nail paint and piercings and tattoos and the clothes that you wear and all of those things. You know what? For gay men, straight men who have sex with men, for bisexual men, they've been through it all. They've been all exposed to those things, but it's the heavy stuff that turns out in the gradient. So I guess, this comes down to what it all means, and to answer Jody's question about how do you put this into effect. I think we have a greater job to do than the distribution of condoms, the forming yet more message campaigns and so on. We've got a work to do in society. I have to say that one of the jobs that I got that turned into a great pleasure was having to edit the proceedings of our youth summit that was held directly after the Gay Health Summit here last November. And what I saw in that was the group of young men that have come into our circle that are now so active, telling us that they really don't want to be used as doing Joe jobs in their volunteer work anymore. They really want action. And I think that the action that we have is somehow to change the social structures that we're dealing with one by one. We've got great work to do in institutional change in order to change the way gay men are treated in the workplace. I know my sister is an HR executive in General Motors in Oshawa, and she tells me that Ontario harassment laws have already been used in her workplace to deal with harassment of lesbians in her own office. So something is working in Ontario, but I can tell you that in BC we have no such laws, and we have quite a few problems with the way gay men are treated even in the public health system here. So I really believe that we have a greater agenda beyond our safe sex agenda to promote with work with the epidemic in gay men. I just want to... I just want to thank our funders and, of course, the people we work with at CBRC.